Good morning, everyone, and thank you for joining us here today as I outline Bill 30, an act to regulate child care services. I'd also like to thank Mary Walsh for being here with us this morning. Mary is the chair of what we call ACNL, which is the Association for Early Childhood Educators, Newfoundland and Labrador. And Mary and her group share the vision and the commitment of our provincial government to provide quality regulated child care services throughout the province. Today in the House of Assembly, I'll introduce the new child care legislation. The last full review of child care legislation in this province was more than 15 years ago. Our new legislation will modernize the current legislation for child care services in Newfoundland and Labrador, while ensuring the provision of quality, safe child care remains our focus. That focus and commitment was no more evident than on September 30th, 2014, when Premier Davis announced the creation of a new department, the Department of Education and Early Childhood Development. In this province, integration of regulated child care services and family resource centres with education at the governance level to form the new department will, in turn, enhance service delivery at the community and grassroots level through development and implementation of common policies and procedures. The ultimate goal of integration is enhanced service delivery for children and families that will promote improved outcomes across a variety of indicators. Our government has been recognized and applauded for this move in a press release from Kathy LeGros, chair of the Pratt Foundation, a foundation based in St. John's that advocates for early childhood programming. She said, "This is a critical step to enhancing early childhood education and care in our province." We are focused on providing regulated child care services throughout the province that are built on three key pillars, and those are quality, sufficiency, and affordability. Those are the building blocks of our 10-year child care strategy, Caring for Our Future, provincial strategy for quality, sufficient, and affordable child care in Newfoundland and Labrador. We launched that strategy in 2013 to ensure that parents who choose regulated child care in Newfoundland and Labrador will have access to high-quality, affordable services. Caring for Our Future presents a vision for a planned, systemic approach for the growth and enhancement of regulated child care services throughout the province from 2012 to 2022. We are currently in year 3 of our strategy, and our government has implemented or continued many initiatives under the strategy, such as the Child Care Capacity Initiative, which supports community and not-for-profit groups to promote space creation in underserviced areas. New early childhood education post-secondary program standards and revised early learning and child care supplements for early childhood educators. These initiatives, coupled with the outstanding array of existing programs and services from birth, aimed at supporting child development, supporting and engaging families, and enhancing the transition to school, illustrate our commitment to our children and families. Services and programs include regulated child care. As of June 2014, we had 7,815 regulated child care spaces throughout the province, which is almost a 70% increase since 2003. Since the strategy started, over 1,000 spaces have been created. From birth to age 3 childhood learning initiatives, such as early literacy programming through partnership with public libraries, parent resource kits, through child health clinics, and the Power of Play promotional campaign focusing on the importance of play for children's learning and development. The KinderStart program, which provides a transition to the school program for 4-year-olds. Kindergarten, with a provincial government investment of $30.6 million. Implementation of full-day kindergarten is expected in September 2016. And family resource centers. The government funding helps provide playgroups, parenting support, and healthy baby clubs. And we are by no means done. Some upcoming initiatives, which are committed to in our 10-year strategy, include a voluntary operating grant program and a web-based child care registry, which I will be announcing in the coming weeks. Quality program in both center-based and family childcare is fundamental to an effective system of regulated childcare, and programming must be supported through an appropriate legislative framework, which is why we felt it necessary to make several key changes to our childcare legislation. The Government of Newfoundland and Labrador currently regulates childcare services through the Childcare Services Act and Regulations, which establishes health, safety, and program standards. The Act was reviewed with a focus on ensuring positive practices are used when providing childcare services throughout Newfoundland and Labrador. The new bill has been restructured and modernized to reflect current knowledge in the childcare field, streamline policies and processes, increase transparency, and to provide flexibility for licensees. It is also based on extensive public consultation and a review of academic research and a jurisdictional analysis. Allow me to briefly outline the 6 key changes proposed in the bill. Firstly, exemptions to licensing. Exemptions to licensing have been clarified and strengthened by stronger definitions of what a child care service and a child care service provider are and what they are not. This clarity will result in consistent interpretation of the need for a service to be licensed. A child care service means an activity or other arrangement that provides temporary care or supervision of a child, but does not include Kinderstart, offered by the Department of Education and Early Childhood Development, artistic instruction, tutoring, or sports for children who are enrolled in full-time school, or day camps offered during school breaks for children who are enrolled full-time in school. A child care service provider means a person who, or an organization that, operates a child care service but does not include schools operating under the Schools Act 1997, hospitals that provide child care services, playrooms, schools to inpatient children, parents and relatives providing child care to a child who is related to them, or a nanny hired to provide child care in the child's home. All other jurisdictions have exemption clauses, and the exemptions we are proposing are similar in scope to other jurisdictions. Secondly, capacity limit on a license. The second change will remove the current cap set on child care center licenses. Licenses in the province are currently limited to a maximum of 60 spaces. This limits the flexibility of a licensee to determine the scope of their service. Our change will allow providers more flexibility and reduce redundancies while not impacting the safety of children or the quality of the service they receive. Quality of service is determined by a number of factors, otherwise known as the iron triangle of quality. The 3 sides of the triangle are staff-to-child ratios, maximum group size in a homeroom, and staff qualifications. There is also a requirement for the amount of indoor and outdoor space per child, which ensures quality. The new Act does not change any of these factors. Our staff-to-child ratio and the maximum group size will remain the same, and the amount of indoor and outdoor space per child will be unchanged. Our requirement in these areas are within recommended guidelines in research and best practices, including the guidelines recommended by the National Association for Young Children. However, the current capacity limit impacts the ability of licensees to determine the scope of their service. And let me illustrate by examples. If you have a building with 5 rooms of sufficient size to accommodate 16 preschool-age children each, you would need to be licensed for 80 spaces. This is not possible in the current Act. Another example, if a licensee wished to offer a child care service for children from birth through to age 13 with 1 homeroom for each age range, in other words, 5 homerooms, they would need 86 spaces. 6 infants, 10 toddlers, 16 preschoolers, 24 kinder care, 30 after school. This, too, is not possible in the current Act. There are currently childcare owners in the province with more than 60 children in one building through holding more than one license in the building, for example, the MUN Campus Childcare Centre. This situation imposes redundancies and red tape, such as more than one application and renewal process is required, difficulties transitioning children from one age group to another, where the next age group is under a different license. Most provincial and territorial jurisdictions in Canada do not limit the capacity of a license. The third change has to do with appeal processes. The third change will see an appeals process for licensing decisions defined. The current Child Care Services Act does not have a defined appeal process. Adding an appeal process provides transparency. Defining an appeal process gives transparency to the process and outlines obligations and expectations for both parties. Currently, 8 of the provinces and territories describe an appeals process in their child care legislation, including New Brunswick and Prince Edward Island. Fourthly, in the current Act, the provincial director must be appointed by the Lieutenant Governor and Council. Our fourth key change in the new Act allows the minister to appoint the provincial director. Public service competition will still apply, as the appointee would be a provincial government employee. Appointment of inspectors. Change number 5 will improve the transparency and accountability of the inspection process. The new Act requires that a manager is not to be appointed as an inspector. This safeguards the inspection process by separating the inspection from the person receiving inspection reports and making decisions based on those inspections. And finally, the sixth change in the new Act concerns the statutory review. Bringing this Act in line with most recent provincial legislation, a review of the legislation is required every 5 years. This review must include public consultation, which supports transparency. These are the 6 key changes that will help modernize our legislation and bring it in line with best practices throughout the country, with a clear focus on providing safe, quality care to our children. Thank you. And now I'd like to ask Mary Walsh, on behalf of ACNL, to say a few words before we take questions.
Thank you very much for inviting us here. ACNL is very pleased that we have a new Department of Education and Early Child Development. We have always worked with government on the same common goals for accessible, affordable, quality childcare, and we will continue to work with this department. I thank all other cabinet ministers and all other government supporters that you support childcare in this province. It shows that our province recognises that educational benefits of early learning and childcare. The new legislation introduced today will help create quality, safe programs across our province. I like that the new legislation is going to streamline policies and processes, and that will support licensees to make quality programs. Reflecting on the key changes, the definition that are going to change for childcare services and childcare providers will clarify to everybody what regulated childcare is, and it will also show to have a regulated childcare program, there are qualified early childhood educators who are trained and professionals working in the field. Capacity limits allows a licensee to define what they want to do, but it also maintains that there will be quality programs. The appeal process will allow the licensees, the operators, and the inspectors to work together to have a safe program. And it also will ensure parents that their child are into safe programs. Best practice inspections are necessary, but I also will hope that this will encourage all centres, licensees and operators to avail of our consultants to enhance our programs in Newfoundland. I am really pleased that there is a review every 5 years. When we just did the legislation, ACNL was consulted, and we sent in a consultation paper, and then we were brought back for a final review. At the final review, there's parents and all stakeholders, and I feel that government has listened and heard everybody's views. Thank you very much.